Okay, so I'm going to be performing a head-to-toe assessment on my friend Megan. So first I'll start with my name is Janelle. I'm going to be your nurse today. I'm going to be assessing you head to toe. Can I have your name and your date of birth?
Megan Turetsky, 12/7/92.
Okay, and then next, do you know more or less what time you arrived today to the clinic?
About 5 minutes ago.
Okay. And your full name is Megan Turetsky, correct? Do you know where you are? What city?
Yeah.
What
Hollywood,
city?
Florida.
Okay. And do you know what time it is?
Maybe 11 o'clock.
Okay. So we're gonna get started with the assessment. First, I'm gonna start with neuro. I'm gonna look at her posture. She is erect. She is sitting up straight. Her body movements are smooth and voluntary. She's dressed appropriately. Her behavior, she is alert and oriented times 4. Her facial expressions are normal when I talk to her. She has clear speech, no hoarseness in her throat. Her mood is appropriate. Her affect is appropriate for the situation. Next, I'm going to move into her GCS. So she has a score of 15. And I have to ask as part of our assessment, have you ever had any suicidal thoughts? Never. Okay, great. Next, we're going to move into the head and face. So I'm going to start with the skin. I'm going to inspect. Her skin color is consistent with her ethnicity. She has no edema, no apparent edema. She appears to be clean, and she has no pallor or cyanosis visible. Her head shape is normal cephalic. It's symmetric on both sides. She has no lesions, no visible swelling. So next I'll move into her hair. I'm going to inspect it. It doesn't look dry or brittle. I'm going to touch it, and I don't feel any lesions or masses. And then her eyes, I'm just going to take these off. Close your eyes. Okay, her skin appears to be consistent with the rest of her face. She has no erythema. Her lids approximate fully, and let me just grab a flashlight so that I can check for perla.
My phone?
Yeah. Do you know how to crop videos?
Yeah. We can get this up. Oh, my phone's right here. Can I have my glasses back?
Yeah. Okay. How do I do your flashlight? Okay, so I'm just going to shine the light in her eyes and assess for perla, which is pupils are equal, round, reactive to light and accommodation. So I'm going to come from here and just look straight for me. Okay, very well. And then just follow my finger. Okay, great. So her perla is intact. She has equal pupil constriction in both eyes. Next, I'm going to look at her ears. Her skin is consistent with the rest of her body. Next, I will notice the size and the shape. They're symmetric on both sides. Then I'm going to pull it up and back and check the tympanic membrane. How do you do it? You go
Slide up. I can't see anything.
Okay.
I took my glasses away from me.
Okay, so I'm pulling them up and back to check at the tympanic membrane. And I'll do that on both sides to make sure that they are intact. Okay. Do you have any difficulty hearing?
No.
No. You can put these back on.
Thank you.
And then do you have any tenderness when I push on your ear?
No.
No tenderness. Okay. So next I'm going to move on to the nose. I'm going to look at the skin. It's also consistent with her face. I'm gonna check inside her nose. There is no septal deviation. And then just, can you hold one nostril for me and blow out? And do the same on the other side. So both of her nostrils are patent. For her mouth, I'm gonna inspect her lips. They're pink and moist. There's no cracking or no dryness. I'm gonna look inside now, inside of her mouth. Just stick out your tongue for me. Move it side to side. Okay. Then I'm gonna look at her teeth, smile. Everything looks clean and intact. Her uvula, stick your tongue out for me. Uvula is midline. And then just say light, tight, and dynamite for me.
Light, tight, dynamite.
Okay, so with this test, I am assessing cranial nerves 9, 10, and 12. Moving on, I'm going to move down to her neck. I'm going to inspect the skin. It's consistent with the rest of her body. I'm going to feel for her trachea. It is midline. And then I don't see a thyroid gland visible or palpable. I'm going to feel for her carotid artery. And then feel on the other side. And just make sure that her heart rate is within 60 to 100 beats per minute. Moving on to the thorax, first, do you have any difficulty breathing at all today? Okay, so no difficulty breathing. I'm going to look at her skin, and it seems consistent with her body and her ethnicity. I'm gonna look at the shape. It's symmetric. Will you turn to the side for me? So her AP diameter is 2 times as it is of the back. Position, she's erect, she's able to sit. And now I'm going to auscultate with my imaginary stethoscope. So turn this way for me. So I'm going to listen in the aortic, pulmonic, Erb's point, tricuspid, and mitral points. I'm going to auscultate for her heart sounds, and in a normal assessment, I wouldn't hear any bruits or murmurs. Do you have any chest pain today?
No.
No chest pain. Okay. So with my stethoscope, I would also auscultate for lung sounds. So I would start from the top and move down in kind of a Z shape as she breathes in and out every time I move the stethoscope. I'm first going to do this motion with the diaphragm of the stethoscope, and then I will repeat the motions in the spots as she breathes in and out with the bell of the stethoscope. Okay, so I would also palpate her breast, which I won't do for the purposes of this video. And then I will educate her on how to do self-examinations on her breast to feel for any abnormal masses. So her upper extremities, I'm going to continue moving down. I'm going to inspect her nails. And there's no clubbing present. I'm going to check for capillary refill and make sure it's less than 2 seconds. I'm going to feel for a radial artery. Okay, make sure the heart rate is between 60 to 100 again. The skin is consistent with the rest of her body. Her hair is evenly distributed. The temperature is warm. It's not too warm. I see no edema. Do you have any tenderness as I palpate your arm? Okay, we'll do the same on the other side. Check for clubbing. Check capillary refill. The skin, no tenderness okay. So moving forward, I'm going to have you lay down on my clinic table. When was your last bowel movement?
Yesterday?
Okay, very good. And do you have any difficulties or pain when you use the restroom?
No.
Okay. So I'm gonna inspect the skin on your belly, and it's consistent with the rest of her body and her ethnicity. I'm going to first inspect. I don't see any erythema, no visible masses. Moving forward, I'm going to auscultate her abdomen before I palpate, and I'm going to start in the right lower quadrant and move clockwise and listen in all four quadrants for bowel sounds. So in a healthy patient, I would expect to hear normal bowel sounds, not hypoactive or hyperactive. Then I'm going to auscultate with the bell of the stethoscope for the aortic pulse in the abdomen. And then I'm going to do the same motions but with palpation. So I will start in the right lower quadrant with 4 fingers. Do you have any tenderness? Okay, and then I will move clockwise into all 4 quadrants and make sure that I don't feel any masses. Feel for the edge. I'm sorry. Feel for the edge of her liver. And just make sure that it's not inflamed. Then I'm going to percuss in the same direction. And I should hear tympany in all 4 quadrants. So you can turn that way for me.
Like this?
Yes. Yeah, perfect. Okay, so now I'm going to check for her PMI, which is on her left side. Check for the point of maximum impulse of her heart. And then I'm going to check for thoracic expansion. So breathe in and out for me. And it's symmetric. So both my hands move open and close simultaneously and the same amount. Then I'm going to check for tactile fremitus. So just say 99 every time I move my hands.
99, 99, 99, 99.
Okay, so I don't hear any abnormal vibrations, so there's no adventitious breath sounds or, yeah. Then I'm going to auscultate in that same Z motion that I did on her chest and listen for lung sounds with both the diaphragm and the bell of the stethoscope. So you can roll over back on your back. I'm going to continue assessing her lower extremities. I'm going to check the skin, make sure it's consistent with the rest of her body. The hair distribution is even, and I see no visible swelling or edema. I'm going to check the temperature with the backs of my hands. And she's not cool. The skin doesn't feel clammy, so she's warm to the touch, but not too warm. I'm going to assess the dorsalis pedis pulse on the bilateral lower extremities and make sure it's between 60 and 100 beats per minute. And lastly, do you have any pain when I squeeze your legs? Okay. So can you lift this leg up? Good. Put it down. Bend at the knee. Okay, good. Now do the same with the other leg. And down. Bend at the knee. Okay, so with this, I am assessing her musculoskeletal ability in her lower extremities. Make sure she has full range of motion. And then if I can just have you stand up and face that way. And just bend forward for me and try to touch your toes. I'm going to assess her spinal column and make sure that it is aligned. There's no signs of scoliosis or anything. Okay, you can stand up, watch your head. So I'm going to now ask you to raise your arms up, forward, and to the side. Okay, put them down, lift them forward this way, and turn the palms up, bend up and down. Okay, very good. So with this, I am assessing her range of motion in her upper extremities. Make sure that she has full range of motion in both arms. So lastly, I'm just gonna have you walk in that direction. So I'm assessing her gait. It seems to be even. She doesn't have any difficulties, no swaying. And then just stand on one leg for me. And then close your eyes. Okay, very good. And do the same on the other leg. And close your eyes. Okay, so I'm assessing her balance and the Romberg test. And with this, I conclude our head-to-toe assessment on my friend Megan.
I'm done.